Hey friends, welcome to our next episode here on Sports Acupuncture. This is our special summer series. Today, we're going to be talking about sporty dogs. That's right, sporty dogs. We've got Kathy Murphy with us today. She's an acupuncturist, she's a veterinarian, and we're going to talk about obedience at speed. We're going to talk about canine sports. The stars of these shows, yeah, the humans go running around an obstacle course, but it's the dogs that are the main competitors. And it's a really fascinating sport. It's kind of up and coming. And we all know that acupuncture is helpful for critters. I got a suspicion all you acupuncturists out there have probably acupunctured your cat or dog or maybe horse at one point and found it really helpful. So today we have Kathy to join us and take us around the course with sports medicine for dogs. Kathy, tell us a little bit about your background and what you're doing.
I was when I originally trained as an equine practitioner, I actually had a dog who had some issues, and one of my colleagues who is a certified veterinary acupuncturist, who's also a veterinarian, actually helped me through it and really spawned my interest in it. I finished my training with the Chi Institute in 2009 and went ahead and got my CVA in 2013 after practicing for a few years before I decided to actually go for the certification. And, I've transitioned out of horses now and have gone into doing dogs. And I have a personal interest in doing dog sports. So I found it very rewarding to help, my friends and their dogs and find different. It's interesting the patterns that we start seeing as the more of these dogs that we start examining as we go through this.
So what was the key thing that kind of tipped you into working with dogs and in particular competition dogs?
I've always liked, I like animals at work. I like that they want to do this with us. I enjoyed horses because they were just so kind and wanted to do everything right. And dogs are the same way, but they have a little bit more quirks to them that they're not afraid to stop. And a lot of them will work themselves down to the point that no one really realized that there was a problem. And that's when I came in, is now I have a problem and I don't really understand because I did all the medicine. I went to the rehab veterinarian. I went to the orthopedist, and they're not really able to pinpoint exact problem. They have some assumptions. We're doing all these tests, but we still haven't come down to a pinpoint diagnosis to be able to proceed. And they're just like, we're willing to try anything. And I feel like as a veterinary acupuncturist, I'm usually kind of the last line of possible, and resolution. And it's just like, it's a little frustrating but working with different dog trainers and showing them the process and how this can be beneficial early on in this issue before these issues become an issue has really, I think, helped as far as educating, the group. It's a small group, of people have decided to dedicate their lives to professional dog training. Yeah, and it's been really rewarding because they're very open to trying new things. And it's been a great thing for me, too.
It sounds a whole lot like humans. They've been to 6 different kinds of docs. They've done all kinds of different tests. They've done this, they've done that, they've done some PT. Something still isn't right. And, it's different with animals in a way because they can't tell you exactly what's going on. But even so with humans, we often can't tell what's going on either. You just know something's right. That's when people come in their door. So what do you do when a dog just doesn't seem to be the dog it was a month ago? It's not behaving the way it was. It's not performing the way it was. It's just, like you said, people have been around the block. They know there's an issue. They don't know what the issue is. The great thing about acupuncture and Chinese medicine for that matter, it gives us some different lenses. How do you apply those lenses to these dogs?
It's really, I end up with these different types of situations with these dogs, and they are pretty much broken up into 2 different issues. I either have a chi deficiency where they just don't have any energy to give. And then I have more commonly in my seriously, like, dogs that really compete at a high level, I have more issues with blood deficiencies. And in the blood deficiencies, they come to the point where they're actually becoming aggressive and they're looking for issues, according to behavior that they think is, chemical. It's a brain chemistry issue, and it's really a Shen disturbance due to the chronicity of their blood deficiency they've had for so long. And my biggest challenge with those is that that's been going on for a long time. It's not going to be treated in one treatment and you're going to have your dog back and everything's going to be beautiful again. It's going to be a process. I almost feel like I need to bring in a human acupuncturist and get the handlers done at the same time as I'm working on these dogs to try to...
I'll bet you do. That makes a lot of sense.
To get them into the same headspace of like figuring out, because I'm pretty sure the dogs are feeding off the people for the most part. I have no doubt. And I know these people are feeding off my treatments on these dogs that I'm trying to help.
So in a sense, Kathy, if I'm hearing you correct, you're treating the dog, but in a way you're also treating the person. You may not be putting needles in them, but you're working with their Shen. You're understanding what's going on for them. I love your rubric here. I love your differentiation between Qi deficiency, blood deficiency. With blood deficiency, they're aggressive.
Yeah. You definitely see a behavioral change. They don't want to be touched. They don't want you coming at them. You try to, the trainers and the handlers are trying to correct them on something and the dogs just leave. They just leave. They're like, I can't even deal with you anymore.
I'm not listening to you right now. I'm not talking to you. Yeah.
Yeah, exactly. Yeah. And the Qi deficient dogs, they're usually the ones that I see are really kind of food picky. Like they're like, there's only certain treats that this dog will eat when they're performing. And then they start backing off and they're just like, they won't work for the food anymore. And I don't know what's wrong. They must have cancer. And I'm just like, I think that's a little extreme. There is that chance, but I'm pretty sure you've done all the workup to be able to rule that out before you come to me. And, I think that we need to work on moving some energy and getting things to open up. And yeah, he's just not jumping. He's jumping really flat. His back end is getting weak and everything else. And I'm just like, that's really, it becomes very classical Qi deficiency that I see when I come down to hind end weakness and people are like, well, I've gone and got a chiropractic. I've gone to PT. I've gone and got massage to help loosen up the musculoskeletal system. And it's just, they're not finding any atrophy. And it's just like, well, I think that's great.
That's great. That's good news. Hey, nothing on the tests. Great news.
I think it is. That makes it better for me and gives me better opportunities to make this work. Because when I have a complete history and a complete diagnostic panel, it really just rules it all out.
Well, I got to tell you, I'm thinking about this in my own practice. I treat humans and my cat.
Good.
The cats love it.
No, they don't.
Mine do.
Well, you have special cats that are used to being handled, and I have to run around with ear needles and try my best.
The other thing is I'm good with cats. So there's that. There it is. I could have a second profession. I just want to comment that I hadn't thought about aggressiveness as a sign of blood deficiency, but I'm going to go look for it in my practice. Hearing you say that, I've got a couple of people that suddenly popped to mind that I hadn't been considering blood deficiency, but now I am.
Yeah, it's kind of crazy, right? Because it's just like...
But it's not crazy.
But when we're in practice, we see the same patterns. We start seeing patterns that become more. And I see quadrupeds who can't talk to me and tell me how they really feel. I mean, I can only go based on what I'm seeing and my diagnostic process. So it is really kind of exciting to be able to narrow these down and try to help these pets, get back to enjoying doing what they originally loved to do with their handlers.
Right. Run around an obstacle course at speed. Quickly.
And they're people, right? At speed.
And eat snacks.
Time to vent.
Tell us a little bit about treating Qi deficiency in dogs versus treating blood deficiency. What are you doing? Are you doing it like we do it in a human, or you got some tricks up your sleeve?
I think in talking to human practitioners, you have a lot more accessibility to distal points than I do. I don't have ability to go into digits that's just not tolerated, which is where I would like to do, but I end up having to use, more traditional points. and a lot of bladder referral points in order to try to get where I need to be with these things. And that's what takes longer, right? I can't go and start stimulating, the source points that I really need in order to try to get this. I have to work around the system a little bit in order to get everything to work around. A lot of times I'm not able to actually directly needle into sites. I have to use a lot of acupressure initially because, stagnation, there's pain, there's difficulty, the dog's not comfortable you touching certain parts of their body, especially in our blood deficient dogs. And now you don't want to have a fight. That's not what we're here for. We're not here for a fight and to make a point of putting these needles in just to do the cure. We're here to help, and help doesn't always come as a direct, one needle is going to fix it all. If I can get this needle into liver 3, I am going to win.
Yeah. Yeah.
No, it doesn't work that way. If we're going to try some other points, I get to stomach 36, and that's usually as far as I can get down for a lot of these dogs initially on my first treatment.
With a needle, but you can get down there with your hands.
With a needle. With my hands, I can. Exactly.
Animals like touch, right?
They're used to it. These dogs have all been handled. They've had massage therapists. They've had PT people touching them, so the touch is not unheard of.
Yeah.
It's just a lot more specific.
Now, yes, it's more specific. That's so true. Is this something that you also teach the owners of these animals about? That
I do. I do think that it's really helpful. And they're just like, I don't know if I'm doing it right. I was like, even if you don't think you're doing it right, do it anyways. Because if you're stimulating even close to it, it's not horseshoes. It can be horseshoes, but at least you're trying. And we're getting somewhere between treatments where you are actually involved and actually starting to recognize some of the releases that are happening during this process too. And I think that's part of the education of the clients. It's important.
you used the phrase horseshoes. From the Midwest, so I'm familiar with that phrase. Close enough for horseshoes. With people, we often talk about points need to be really precise, especially if you're doing like Japanese acupuncture, other forms of acupuncture, very much focused on precision. Is it the same with animals, or do you have a little bit more leeway? I know you're not a human acupuncturist. It
Yeah.
might not be a fair question, but what's your sense of that horseshoes? Like, what's the zone for an animal that you need to be in to be effective and helpful?
Quadrupeds are a lot different than bipeds. And different structures, like a pug versus a Great Dane. They have the same structure, but the location of the points may be slightly different just because of the size and the variation within that. And when I am lucky enough to have a large enough dog to do something like that, yeah, I do like to pull out a thicker needle, a bigger needle, a longer needle, and try to get into these points. But I do find that it's still effective. I had someone introduce me to Japanese needling, and I found that to be wonderful, actually.
Wonderful. Tell us about that.
It is. It's just getting through the skin and not actually, I was trained in traditional Chinese medicine. They're like, you got to dig in there. You got to get that point, and it's never going to work if you don't do that. And I go, okay, we want it to work, so we're going to try to dig. And the Japanese are like, if you can be, like you said, very specific and you can get into that location and just stimulate it, it'll work. You may take more time, but it's going to work. And I'm just like, I wasn't much of a believer. And then I tried it and I was like, wow, I can go into this tiny chihuahua and just put this tiny little ear needle in and just through the skin, and the dog can relax. And it's really nice.
Do you find that different dogs respond differently to different needling? Or, yeah?
I do. I do think that, like, initially they do. And then as they become more accustomed to it, they're a lot more accepting to many, many other needling techniques.
Mm-hmm. Humans are kind of like that too. They get kind of used to it. In a first treatment, you don't want to be too aggressive, scare people off.
I'm horrible.
Yeah, there's that.
Yeah, exactly. Because then you scare them away, right? Like if some dog reaches over and tries to bite me in the middle of me trying to put a needle in, it's not really.
I've yet to have a person try to bite me.
You had a person try to bite you?
No, I said I've yet to have a person try to bite me. No, not yet. Not yet. You never know.
Like, oh my gosh, you muzzle them, drug them.
So I'm just back to this thing about blood deficiency. I
Yeah.
mean, gosh, you said it, and now I just can't forget it because seriously, it's kind of changed how I'm thinking about things in terms of aggression. But it also brings up for me the questions of like, this is a very yin yang thing. This is like
Right.
Chinese medicine 101, right? The balance of rest and action. I would think with these kind of athletic dogs, they need plenty of movement and training, but they probably also need time to recover. How do you
It,
look at that and how do you work with that?
you know, I've talked to a lot of other veterinarians who do this as well, and a lot of different sports and species that they work with. And there's a lot of them that just like put the needles in, they give them, 30 minutes of treatment, pull the needles out and be like, you're ready to go. And I'm just like, in the grand scheme of things, if you think about how this process is supposed to work with acupuncture, it's not something that is immediate. You are trying to sit there and open up these meridians, and you're trying to get this energy to flow or get this blood to start moving. And you then are just going to go throw them back into the same stressor and the same situation that caused this issue. And it doesn't make a whole lot of sense to me. So I personally like to rest them for 3 days.
Mm.
You can go out, you can play ball, you can have a long walk and go for a hike, but no training, because the mental stress and the physical demands on the pet is hard. And also the stress of the handler trying to figure out what they're going to do and if they're going to execute correctly, and their own criticisms on themselves definitely play a role. That's not a rest for the dog. That's not rest.
So a certain amount of activity, not too much, not too little. That's useful.
I don't think it should be a specific activity. I don't think you should sit there and say, okay, today we're just going to work, in agility, we call it jump grids. There's just these couple jumps set up and we're going to work on handling this. No, that's still requiring a lot of thought. And it's also requiring a certain specific type of movement and collection and biomechanical, thought by the pet. So I do think like hiking, yeah, you're on your own. You get to decide how fast you want to go, how slow you want to go. It's a lot more manageable. And it's dependent upon the animal's choice, not so much the handler's direction.
Ooh, the animal's choice, not the handler's direction. Okay, so this brings me back to something you said earlier. This might be a little provocative. I'm going to ask it anyway. In your treatments, how much are you treating the animal and how much are you treating the handler? Again, I know you're not putting needles in handlers.
Yeah, that's illegal.
But with your words and your actions and what you say, you can certainly have an effect. How much are you treating the person versus the animal?
I would say it's probably 40% the handler and 60% the animal. Because we have to be on the same line. Like, we have to be following the same path. If I am following this path to help your pet, I want you to be on this journey with me. I don't want you to feel like you're isolated and not part of this.
Mm.
And I do think, because they're a team, one of your team members is not well. We're going to get your team member well, but you need to be on board and follow this process and be okay with it, because if you're not going to support and give good energy toward this situation, the likelihood of healing is very low.
Yeah. Wow. That's potent. That's powerful. What does an exam look like for a critter? I know,
Yeah.
With people, we take their pulse, we look at their tongue. Sometimes we palpate their abdomen. How do you figure out what's going on with the dog, with a quadruped?
The problem, I really have an issue. Like, I love the fact that people look at tongues. I think horses are probably easier to read tongues on than there are dogs, because we feed them so many treats to reinforce behavior and to bring calmness. It's like, oh, you're getting food, so you're a good dog, so you get to be calm. And these things can change the texture of your tongue, the coating, and it doesn't fall into such an accurate kind of representation of what's necessarily going on. Me telling the owner is like, don't give them any water and don't give them any food before you come in, because I want to see what their tongue looks like, it's really not going to be something that's going to jive real well with a lot of people, as far as, me trying to tell them how to manage their pet and how they do their training. I find, pulses and femoral pulses is what we look at in dogs and cats.
Mm.
to be a lot better representation of what's going on in there. And ironically, even when I'm practicing regular veterinary medicine, I do pulse just about everything I touch just because I can, because
That's great.
it's a learned skill, right? You will lose it if you don't use it. So,
That's right.
it's really an interesting, you know, it, it's a, it's fun. It's fun.
It is fun, and it's a useful diagnostic.
It's a useful diagnostic. Like I can sit there and palpate ting points and everything else on these pets and diagnostic points and everything else. But in the grand scheme of things, like that's just the surface. We're treating more than just the surface.
Yeah. That's great. Anything else that you'd like to share with us about taking care of animals, and maybe even a tip or two about not just competition dogs, but how we might even think about looking after our own critters that we love and care for?
I mean, I definitely find, that Veterinary Medical Association finally acknowledged that acupuncture is a great modality, and they've only approved it for pain. But there's so many other things that people just don't appreciate that could be associated with it, such as, digestive issues, IBD, things like this that happen, especially in cats and in a lot of dogs, and not just orthopedic issues. Can I stop your dog from having heart failure? No, but can I help assist them so that they're more comfortable as they stay on these medications? Yes. Yes, I can. But I'm not going to do it in one visit. You're going to have to come in for a series of visits for us to make headway with this. And that's my biggest thing is just like, I feel like people are very misled. They think, well, you put the needles in. It should be done. You're just not very good at what you do because you put the needles in and they're not better.
You know what I think is one of the big problems with acupuncture?
Tell me.
Sometimes you put a few needles in and miracles occur. They really do. Sometimes it's just like, holy moly.
It's true.
The heavens opened up and things dramatically changed. Then people go out and tell all their friends about it. So sometimes amazing things happen. I think that actually works against us much of the time because people then expect, well, you're going to do this once and then I'm done. It's like, no, actually, I want to see you for 4 weeks and then do a reeval.
Exactly. Or you sit there and they just like, I didn't really get a whole lot of that first treatment. I don't know if I really should come back. And I'm just like, I'm sorry to say it. It's an onion, okay? There's layers. We are not going to go through all the layers in one treatment. It's going to take some time because you didn't just do this yesterday. These are not things that just happened. Acute injuries, yeah, like I do some disc dogs. The dogs are paralyzed in their back end. Yeah, they just, they crimped off part of their cord. Like I can help that. Yes, that is the exception to the rule. But those dogs are coming in every 3 days to get treatment, to get that fixed. That's not something where one treatment and that dog's walking.
Yeah, there's certainly a lot of, I'm going to call it patient education, expectation setting, I think.
Yeah, and that should happen initially. Like I sit down and I'm like talking to them and I go through it. And before I even start the treatment, I'm just like, hey, this is what I'm seeing. This is how I think the course of this therapy should go. It's not just a treatment. It's a therapy process that we have to do. And I want the expectation for at least 3 to 4 treatments, at least.
I would suspect that, lucky for you, people that handle these athletic kinds of dogs, they've got an idea that things are usually a process. Is that true, or are they actually looking for a miracle mostly?
I think, everybody's hopeful for a miracle. I do feel like some of the people that have been doing this longer are a little bit more in tune, but everybody's looking for a quick fix.
Nice if you can get it.
Everybody's looking for a quick fix.
Sure.
I do think that, the animals are crafty. I do. I think the dogs and the cats and the horses, they're really good at hiding things. People don't even realize that there's been a change until much further along in the therapy because they didn't realize that part of their pets, personality was missing or had disappeared or they just aged out or they just don't have interest in playing with toys anymore. And all of a sudden they're playing with toys again by themselves. These are things that you can't sit there and be like, yesterday I felt pretty good. Like my belly wasn't bothering me. And I went for a nice walk and I felt great. And, the dogs are just in there like, hey, I ate my dinner. I gave you hugs. That's all I got.
Oh, those personality changes really, it's
really hard. I feel like the dog people that do competition are a lot more in tune to those personality changes. So they're a lot more aware.
Mm-hmm.
But the fact is that sometimes they make a lot of excuses for them and they let them go a little too long. And that's where some of the issue falls.
Well, you know how athletes are. Well, it hurts a little, but I got a big game.
Yeah, exactly. Or I think we can be okay. We have world team tryouts or something crazy.
Yeah. Oh, my goodness. Well, if people would like to find out more about what you're doing and get in touch, where do they go to find you?
I work and co-own Life Care Pet Hospital in Chantilly, Virginia. I am there. It's lifecarepethospital.com is our website. You'll see me around in the DMV area competing my own dogs, and I usually end up, carrying some needles and things.
It's probably great for business to compete with a dog, isn't it?
Well, it is, but a lot of it comes into, it's hard for me because I want to help. It's hard for me to sit there and charge people to show them acupressure points. Like, here, I really think you should try this when you go home tonight, or if you want to use your PEMF mat, your, peripheral electromagnetic force, thing that cost $500. That's fine. But you can also press these areas on your dog's body at the same time.
That's right. Liver 3, baby.
Compound those treatments. Let's make it happen.
Yeah. All right. Well, Kathy, thank you so much for your time today. And
thank you, Michael. It's been great.
Yeah, it's great hearing about these dogs. Take good care.
Yeah, different, right?
When practitioners reach for Chai Hu Guizhi Tang or Xiao Qing Long Tang, they need quality that they can trust. Lhasa OMS supplies the herbs your clinic needs to be ready for the cold and flu season. Visit Lhasa OMS to source the classical formulas featured in this series. Use the code REMEDY20 for 20% off your next purchase at lhasaoms.com. Some exclusions apply. See the website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.